SPIE presents the Advancing the Laser series, honoring 50 years of laser achievements.
My name is Haishin Zeng. I'm a senior scientist at here at the BC Cancer Research Center. I'm leading a group mostly developing laser-based imaging and spectroscopy technology for early cancer detection. We also do some light-based, laser-based therapy research. Light is actually it's an ideal tool for early cancer detection. The reason is because most of the cancer, more than 80% of the cancer start on the surface, either external surface like the skin or internal surface. The conventional medical imaging modalities like CT and MRI, they're very good at look at the anatomy, but their resolution is not high enough to look at the superficial changes. And the light, which doesn't penetrate much deeper into the tissue, but they can interaction with the surface of the tissue. Only interaction with the surface of the tissue, and actually that's where the cancer arises. So it's an ideal tool for early cancer detection. And it's also low invasive, it's a low ionization radiation, so you can do the job without doing any harm to the tissue.
Okay, my name is Michael Short. I'm a postdoctoral fellow here, and I'm working on endoscopic applications of Raman spectroscopy. So we developed this probe here, and it goes down the endoscope. It carries the laser light down onto the tissue surface and excites the tissue surface, and then we collect the emission from the surface back through the same probe, and then we analyze the spectrum, which gives us details about the biomolecules in the tissue. So we use that to differentiate between different disease states. So this is the actual probe, and there's one excitation fiber in the tip, and then there's 27 collection fibers. So now I'm getting a spectrum from my skin, and this is enabling us to see all the different biomolecules that are in my skin. And then we apply the same process to in vivo applications on a patient internally, colon or the lung, anywhere in the mouth. And we can actually pick up different changes in the tissue biomolecular composition, things you can't see with your eyes, but there are subtle changes taking place, and these subtle changes are actually give us an indication of whether there's disease there or not. So it's a tool really for the clinician to use. So this probe goes down inside, there's a channel that enables them to take a biopsy, but we use it to actually put our probe down. You can see this in a video real image where the probe is in relation to the tissue surface, and then he can direct it to the point of interest and take a spectrum. And what our clinical trial is trying to show is that this spectrum will enable us to determine whether it's cancerous or non-cancerous. So we've measured 50 patients so far, and we're getting about a 90% sensitivity. So it's looking promising.
My name is Tracy Wong, and I'm a PhD student in Dr. Zeng's lab. And I'm mainly working on this confocal Raman spectroscopy system. So basically, as Dr. Zeng introduced, we measure the subtle changes inside the tissue, and we can do depth-resolved Raman spectroscopy measurement. So that mainly we focus on this technology used in skin research. And you know, as skin, there are several layers of the skin, and then we focus on the top surface and moving down into the dermis, we can actually get different signals from different layers. This is the Raman spectrum of silicon wafer. This is the confocal image of that wafer. So we can actually look at the image and also get the spectrum simultaneously.
So you actually we put the mice here, or put your the skin, your hand, underneath the objective here to do the actual measurements. I think laser and the light is probably the only hope. As I said, because those lesions arise from the surface, the traditional medical imaging modality wouldn't work. And the light is non-invasive, and now we have accumulated so much knowledge. We know that with spectroscopy, such as Raman spectroscopy, and with those microscopy, multi-photon microscopy, you can achieve micron and sub-micron resolution. So you actually be able to get those information which the pathologists get, but they cut the tissue out. And I'm quite confident down the road we can make this spectroscopy for biochemical analysis, and microscopy for morphology, histology, in vivo histology analysis working, and those at the end of the day that will solve the diagnostic problem. Okay.